everyone, Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you have requested. The area of interest is the lower wisdom tooth impaction. The wisdom tooth on the lower right hand side will show you the transaxial view. This is the mesial aspect. So the mesial aspect you can very clearly see. This is the impacted wisdom tooth. This is the mesial root. As you can see, this is the mesial root. The tooth is almost completely impacted. We've got thick cortical plate on the buccal as well as on the lingual side. This orange highlighted area is where the inferior alveolar nerve is. As we move further down in the interarticular area, you can actually see that the inferior alveolar nerve almost loops around or just gets between the two roots of the lower right wisdom tooth. So there is a very significant chance of nerve damage when this tooth will be extracted because of the close proximity. So this is something that needs to be kept in mind while extracting the lower right wisdom tooth. As you can see, the lower right wisdom tooth mesial root compresses the inferior alveolar nerve. At one point, it almost comes between or roots loop around the inferior alveolar nerve. This is the lower left wisdom tooth. This is a mesioangular impaction. As we will go from the mesial aspect towards the distal aspect, you will see that the inferior alveolar nerve mid-root level is still quite significantly far away. And as we come close to the apex, the inferior alveolar nerve is still at its most closest point, is approximately 3.7 millimeters away from the roots of the lower left wisdom tooth. So the lower left wisdom tooth is absolutely safe. It has no relationship with the inferior alveolar nerve. It is placed lingually and it has have a thin lingual plate, but otherwise the tooth looks in an absolute perfect position to be extracted. This is the axial view, which is the top to bottom view. So here you will be able to appreciate that this is the right hand side where my arrow is pointing, and this is the left hand side. As we move more inferiorly, you will be able to appreciate that this is where the roots of the wisdom tooth, and because this has four roots, which are the mesials are fused, and then we've got a radix intermoralis here as well. So this is a quite a well formed root tooth, and this is where the roots come in very close contact with the inferior alveolar nerve. Thank you very much.